I'm Vicky. I'm a nurse. I'm currently working at Addenbrookes in the Children's Emergency Department. For the past 3 years I've been working with Médecins Sans Frontières in Sudan, Uganda and last year in Darfur. I was sent to Darfur for 6 months. Generally when it's perhaps a more challenging project, they only let you go for 6 months. Usually if it's a little bit more stable, they'll send you for 9 months or a year. So I knew it was going to be a bit tough for the fact that my contract was 6 months. And they fly you to Brussels, where you have your briefing with your head of country and things. Then I was flown to Khartoum, where again you have more briefings, and then put on a helicopter to Darfur to my project. I was in Kaguro, which was up in the mountains, probably one of the most beautiful places I've ever been. And I think when you think of Darfur, you see this dusty desert, but Kaguro was mountains and green and just gorgeous, utterly gorgeous. And MSF was in Kaguro specifically because it was a rebel-held area, and all of the hospitals and clinics are in the government-held towns, so the rebels didn't have any access to healthcare. In the beginning, it was just myself and a logistician, Fune, from Guinea, and our national staff, so our translators and our drivers and things. It's a little bit tricky in Sudan to get visas in and out. You have to have an entry and an exit visa, and it can take a long time. So unfortunately our doctors were being refused visas for a while. So for 2 months I was the only medic on the ground, which was quite tough because I am a nurse, so there's a limit of my capabilities. But then after 2 months, Tira came, who's a doctor from Indonesia, and she's great because she can do minor surgery as well. And because we had no possibility of referring our patients because they were deemed to be rebels, so we had to deal with whatever we saw in our clinic. I think when you're in an area that is fighting and at war, what you actually see is the civilian casualties that come in, and it's actually the effects of war. So you get, the children that malnourished because they haven't been able to have access to their fields, to their crops to grow the harvest. I know the janjaweed destroyed all of the wells, so there was no access to clean water, so we had huge diarrheal problems, skin diseases. The women had no access to antenatal care, so we had a lot of obstructed deliveries, a lot of pregnancies where the baby died. And then, of course, on top of that, you do get your war wounded. But because they don't have access to transport like we do, the miracle hour or the miracle 4 hours that you would have in England doesn't happen. So the war wounded we tended to get were injuries to limbs, the occasional abdominal injury, but mostly they would die on the field because there's no mechanism of actually transporting them to the health facility. But MSF does have very good facilities and resources, so I think sometimes people vision that we don't have enough fluids and we don't have things, but we actually do have all the medicines that we need, all of the fluids that we need to resuscitate people, all the antibiotics. Sometimes it's just a case of actually getting the human resources in there to be able to use them. The worst thing is you think, if this patient was in Addenbrookes, they would live. But because they're here, they're not going to. But then that is most definitely the hardest thing. A woman having a baby, you think, well, if she can have a C-section, both that baby and that mother will live. But the outcome might be in Darfur that actually both of them will die. And again, for some of the war-wounded cases, a surgeon here would save that limb, would actually save that leg, but you can't do vascular surgery in Darfur, it's a specialist thing, so that young gentleman loses his leg. So it's cases like that, but then you have to be able to step back and then look at the rest of your clinic and say, well, actually, there's another 40 inpatients whose lives you have saved, and although he has lost his leg, he's actually still alive, whereas if MSF wasn't there, he would have become septic and died. So you have to weigh it up. But I think that's the hardest thing. And also, the chronic problems. People forget that in Darfur, a child might be diagnosed with diabetes, but they have no access to insulin, so they're going to die from that. They have asthma, all these diseases and hypertension for the older people that we see here. And that's really infuriating, because you think, goodness, these are really sort of basic chronic diseases that can be treated, but you actually know that they're going to die from it because they can't get the access. And if they could access it, they couldn't afford it anyway because it's not free. I think the gut feeling I'll never forget is when you're standing there alone and you put your plastic apron on and you can see these people coming in on their donkeys, and you put your gloves on and you say to your staff, right, let's draw up some fluids and I want the cannulas all laid out and we have our beds ready. And just to look at somebody who's, you know, been shot in the femur or shot in the abdomen and they're strapped to a donkey, and you just think, oh, it's just so pitiful. Or a woman who's been in labour for 3 days and is unconscious and is strapped to a donkey, and then they just plonk her on the bed and you do your best. I think that those are the images that stay with me. Clinically, I think you improve hugely, absolutely hugely. You don't have blood test results to rely on. You don't have an X-ray machine, you don't have an ultrasound. So you literally just have to go on your clinical judgment. You have to decide for yourself if you think that person has a tension pneumothorax. You have to just, what you can hear with your stethoscope, what you can palpate with your hands, you know, you just literally your clinical skills. And I think as a nurse and a doctor, you improve tremendously because you have to rely on your basic clinical skills. Obviously, it'd be lovely to have an X-ray that could clearly show you the problem, but personally, I've improved clinically very, very much. Out of my 3 missions I've done so far with MSF, Darfur was the hardest. I think it was the first time that I had really seen a lot of conflict, a lot of rape cases, a lot of gunshot wounds. And it's like you see the worst that humankind can do to each other, at the very worst, and just the things that they can inflict upon each other, the complete lack of humanity. But then in the same day, you see this huge, you know, just the most wonderful, caring, tender moments that people do still really care for each other, do want to make their life and their world a better place. So it's huge, huge peaks and troughs working for MSF.